Dear doctor, here are the top 5 mistakes that you can avoid while making your website. Number 1, to not make it responsive. In today's time and age, your website would be accessed on many different screens with varying resolutions. It could be a portrait mode 1920 by 1080 on a mobile phone, or it could be a landscape mode of a 1920 1080 on your desktop. Both are absolutely different. To add to that, it could end up being accessed on your iPad or some tablet, or even your foldable screens, which are a completely different resolution. Therefore, your website must be responsive to adjust and align the elements on your screen to look properly across all these mediums. It should not be that your homepage banner is floating somewhere else, or there's a floating icon or widget that's dropping up in between, or some paragraph text is being cut. This can be avoided by making sure your website is responsive. Number 2, not adding enough layers of security. A SSL certificate is the basic thing that you can add to your website, which does not cost a lot but ensures that when Chrome or Safari are loading your website, they show the lock icon on the upper left corner, which ensures that your website is secure and the user who's accessing it is also notified that it is secure. Otherwise, there's a huge message that flashes up saying, "Warning, do you want to proceed to the site? It does not seem secure." Now that could be quite off-putting for a patient or someone who's just browsing through your site, right? So to avoid that, use a SSL certificate. Number 3, putting too many elements on your home page. This is a part of your UI UX, that is user interface and user experience. As a user, if you put too many things and crowd the user when they come to visit your site, it becomes difficult to try and convey the message of what exactly the doctor wishes to portray. As discussed earlier, if your website is responsive and there are too many elements, again it could pose a bit of a problem. Most importantly, if it's too image heavy, or if there are multiple widgets loading, or a book an appointment form and all of them coming up, then it will take a longer time to load, even with your 5G speeds on a good phone, because that's how your server would read and it would be overloaded using more bandwidth. Number 4, not tracking the visitor metrics. Apart from Google Analytics, there are many simple, free, easy to use tools that would tell you how many visitors are actually visiting your website. This doesn't mean you necessarily need to display how many visitors are visiting, but where are they coming from, where is your traffic flowing in from, how can you optimize it better, how long are they staying on a particular page, what are they clicking the most. All of these are important metrics to be keeping track of. You don't need to look at it daily. You could browse it once a month, or your web development team could help you with that, or even better, a SEO team could optimize it for you to ensure that it is performing at its best. Number 5, loading up your home page with too many images that are either gory or not very pleasant to look at. Often doctors want to put forth their best cases that they have treated, and usually put forth too many images about either before, after, or some surgery, or some tumor that's been excised, and all of that. But as a user, as a patient, that need not necessarily be a very pleasant sight to look at. Yes, you cannot do without these cases. They are an important part of the message that you wish to convey, but they shouldn't necessarily be on your home screen to directly repulse some users or kind of put them off the moment they look at it. Of course, this differs from use case to use case. For example, for a dermatologist, we would end up putting a few images there that would look aesthetically pleasing, or there is some kind of tissue excised, or some kind of acne or scarring. But that is an exception to the rule. So keep your website clean, simple, easy to read, make sure the content is precise and is super quick to load, conveys your message to help your patients make a better decision about consulting you.